It is 3 o'clock in the morning. The house is completely quiet. Everyone else is fast asleep, but you are wide awake, sitting on the edge of your bed, staring down at your feet. They are burning, not from heat, not from an injury, just burning from the inside, like someone lit a slow fire beneath your skin. You press your feet against the cold floor, hoping it helps. It does not. You have felt this before many times, and you are exhausted from it. You have told your doctor, you have complained about it, and the answer you keep getting is the same few words that make you feel completely alone with this problem. It is just your age. But what if that answer is wrong? What if what you are feeling right now has nothing to do with getting older? What if the real cause is something that has been quietly hiding in plain sight, something completely preventable, something that many people never even think to check? And what if the very medications you take every single morning to stay healthy are actually making the problem significantly worse? That might sound hard to believe, but by the time you finish reading every word here, you will understand exactly what is happening inside your body and what you can actually do about it. Your body contains approximately 45 miles of nerves. That is not an exaggeration. 45 miles of tiny pathways running through every part of you, from the top of your head down to the very tips of your toes. These nerves carry messages constantly. They tell your fingers when something is hot. They tell your feet where the ground is. They help you keep your balance when you stand up. They let you feel a gentle touch. Without these nerves working properly, your entire ability to move through life safely begins to fall apart. Every single nerve in your body is wrapped in a protective coating. This coating is called myelin. Think of it the same way you would think about the plastic insulation that surrounds the wires inside a lamp or an appliance. That plastic coating keeps the electrical current moving cleanly and in the right direction. Without it, the current gets confused. Signals cross, things short circuit. The same thing happens inside your body when myelin starts to break down. The messages your nerves are supposed to carry begin to go haywire. They misfire. They fire when they should not. They fail to fire when they should. And your brain receives a flood of confusing signals that it can only interpret one way: as pain. When that protective myelin coating breaks down, the symptoms you experience can vary quite a bit from person to person. Some people wake up in the night with that deep burning sensation in their feet that feels impossible to explain to anyone who has never felt it. Others describe it as thousands of tiny needles pressing into their hands all at once. Some people lose feeling gradually, noticing that their feet seem strangely numb, almost like they are wrapped in thick socks even when they are barefoot. Others lose their sense of balance without understanding why, catching themselves grabbing countertops and door frames just to stay steady. These are not random complaints. These are signs, clear, specific signs that your nerves are struggling. This condition has a name. It is called peripheral neuropathy. The word sounds complicated and clinical, but the meaning is straightforward. It simply refers to damage occurring in the nerves that sit outside your brain and spinal cord, the nerves that reach your hands, your feet, your legs, and your arms. More than 20 million people in this country are living with it right now. Many of them have been told it is simply a part of getting older. Many others have been told it is caused by diabetes and nothing more. And most of them have been told in one way or another that there is not much that can be done. That answer is not always true, and it deserves to be challenged. The early warning signs of this condition often go unnoticed or unaddressed for far too long. A little tingling in the toes gets explained away. A mild burning sensation in the feet gets blamed on standing too long. A moment of lost balance gets chalked up to being tired. But when these things begin happening consistently, when they happen at night, when you have done nothing strenuous, when they happen first thing in the morning before you have even started your day, they are not random. They are a pattern, and patterns have causes. The body does not produce pain and discomfort without reason. Something is driving these signals, and finding that something is entirely possible. Here is what too few people are ever told. In a very large number of cases, peripheral neuropathy is not caused by aging. It is not an inevitable consequence of the years you have lived. It is caused by a deficiency, a shortage of one specific nutrient that your body absolutely requires to build, protect, and repair its nerves. Without enough of this nutrient, your nervous system cannot maintain itself. The myelin coating deteriorates, the nerves underneath become exposed and vulnerable, and the pain, the tingling, the numbness, and the weakness you feel are your body's way of sending out a distress signal that it desperately needs something it is not getting. Now, here is the part that truly deserves your attention. Many of the medications that people over 60 take regularly, medications prescribed for completely legitimate health conditions, can actually block your body from absorbing this critical nutrient. This is not a rare side effect buried in fine print. This happens often, and it goes unrecognized for years in millions of people. One of the most commonly prescribed medications for type 2 diabetes is a drug called metformin. It is taken by enormous numbers of people every single day. And research has shown clearly that metformin interferes with the body's ability to absorb vitamin B12. Not slightly, significantly. Over time, people taking this medication without B12 monitoring can develop a serious deficiency without realizing it. Then there are the medications taken for acid reflux. Proton pump inhibitors are among the most widely used drugs in the world. They work by reducing the amount of acid your stomach produces. That sounds harmless enough, but your stomach acid plays a critical role in releasing vitamin B12 from the food you eat. When you suppress that acid, you reduce your body's ability to extract B12 from your meals. The medication does its job for acid reflux, but it silently and steadily creates a new problem in the process. And this can go on for years before anyone connects the dots. Age itself also plays a role that makes this worse. As people grow older, the stomach naturally produces less acid on its own, even without any medication. This means that even someone not taking acid reducing drugs may find their ability to absorb B12 declining year after year. Add a plant based or vegetarian diet into the picture, since animal products are the primary natural sources of B12, and you begin to see how multiple factors can quietly combine. You might be eating reasonably well. You might be taking your prescribed medications as directed. You might be doing everything your doctor has asked. And still, silently, your B12 levels are dropping lower and lower while your nerves pay the price. When your body runs low on vitamin B12, it cannot do two things that are absolutely essential for nerve health. The first is myelin repair. Healthy nerves constantly undergo a process of maintenance and renewal. The protective coating around them naturally wears down over time, and the body rebuilds it. Vitamin B12 is a central player in that rebuilding process. Without it, the coating continues to erode, but the repair work never happens. The second thing B12 does is support energy production inside nerve cells. Your nerve cells contain tiny structures called mitochondria, and those mitochondria are responsible for generating the energy that keeps nerve cells alive and functioning. When B12 levels fall, the mitochondria cannot do their job efficiently. Toxic waste products that would normally be cleared away begin to accumulate inside the nerve cells. The cells weaken. Their signals become unreliable, and the damage spreads. What makes this particularly serious is that both problems happen at the same time. The outer coating is breaking down, while the inner cell is also being poisoned by its own waste. It is a two-front attack on the nerve, and the nerve has no way to defend itself without the one nutrient it is missing. This is why people with untreated B12 deficiency do not just plateau at a certain level of discomfort. The symptoms tend to grow progressively worse. The burning spreads, the numbness creeps further up the foot, the weakness in the legs becomes more pronounced, and what began as a nighttime annoyance becomes a daily reality that affects every part of how a person lives. If any of this resonates with what you have been experiencing, the most important thing you can do right now is get tested. But you need to be specific about what tests you ask for, because a standard blood test alone is not enough to give you the full picture. A basic test will measure the total amount of B12 circulating in your blood. However, that number can sometimes appear normal even when your cells are not actually receiving enough B12 to function properly. The tests that reveal what is truly happening at the cellular level are a methylmalonic acid test and a homocysteine test. When these two substances are elevated in your blood, it is a strong indication that your cells are not getting adequate B12, regardless of what the standard test shows. Ask your doctor specifically for these tests by name. Once you know your levels, supplementation becomes the next critical step. But not all vitamin B12 supplements are created equal, and this distinction matters enormously. The form of B12 found in many basic, inexpensive supplements is called cyanocobalamin. While it technically contains B12, the body must convert it through multiple steps before it can be used. For many older adults, especially those with digestive issues or genetic variations that affect nutrient processing, this conversion does not happen efficiently enough. The forms that are far more effective are methylcobalamin, adenosylcobalamin, and hydroxycobalamin. And these forms are already in a state the body can use more directly, and they are significantly more bioavailable for people whose absorption pathways are compromised. Even with the right form of B12, absorption through the digestive system can still be a challenge for many people. This is especially true for anyone with stomach issues, anyone who has had gastrointestinal surgery, or anyone taking acid reducing medications. For these individuals, bypassing the digestive system entirely is often the most effective strategy. Sublingual tablets, which are small tablets designed to dissolve under the tongue, allow B12 to be absorbed directly into the bloodstream through the tissues of the mouth. Liquid drops work similarly. For people with very severe deficiencies or significant absorption problems, intramuscular injections administered by a healthcare provider deliver B12 directly into the muscle where it can be absorbed with maximum efficiency. Dosage is another area where people often go wrong. The standard recommended daily intake for B12 is quite modest, but those numbers are designed for healthy adults with normal absorption. They are not designed for someone trying to correct a deficiency or support damaged nerves. For general maintenance and prevention, a dose of around 1,000 micrograms daily is commonly recommended by practitioners who specialize in this area. For someone who already has nerve symptoms and is actively trying to support nerve repair, doses ranging from 1,000 to 5,000 micrograms daily for a period of several months may be needed before meaningful improvement occurs. This is not a situation where a small amount will produce quick results. Nerve repair is a slow process, and consistent, adequate supplementation over time is what makes recovery possible. Vitamin B12 does not work in isolation, and combining it with other key nutrients can significantly enhance its ability to support nerve healing. Vitamin B6 in its active form, called pyridoxal 5 phosphate or P5P, works alongside B12 in many of the same neurological pathways. Folate in its methylated form, known as methylfolate, is another critical partner, particularly for people who have difficulty converting standard folic acid. Vitamin B1 in a fat soluble form called benfotiamine has been studied specifically for its ability to penetrate nerve cell membranes and support repair from the inside. Magnesium plays a role in hundreds of enzymatic processes, including those involved in nerve transmission. And alpha lipoic acid, a powerful antioxidant, has been shown to reduce the oxidative stress that contributes to nerve cell damage. Together, these nutrients create a far more comprehensive environment for nerve healing than B12 alone. Food also plays a role that should not be underestimated. Liver and organ meats are among the richest natural sources of B12 available anywhere in the diet. Shellfish, particularly clams and oysters, contain extraordinary concentrations of it. Salmon, sardines, beef, eggs, and dairy products all provide meaningful amounts. For someone who eats a varied diet that includes these foods regularly, dietary intake can contribute to overall B12 status. However, it is important to understand that even consistent consumption of B12 rich foods may not be enough to correct a deficiency in someone with compromised absorption. Food and supplementation work best as partners in this process. One of the most sobering aspects of peripheral neuropathy is what happens when it is left untreated for too long. Nerve damage, when it is allowed to progress far enough, can reach a point where it becomes irreversible. The nerves lose their ability to regenerate. The pain becomes a permanent fixture of daily life. Mobility begins to go. The simple act of walking to the kitchen, climbing a short flight of stairs, or standing long enough to prepare a meal becomes genuinely difficult. Independence erodes. The quality of life declines in ways that affect not just the body, but the spirit as well. This is why the timing of action matters as much as the action itself. The earlier the deficiency is identified and addressed, the greater the chance of meaningful recovery. There is genuinely good news in all of this. Nerves possess a remarkable ability to heal when they are given what they need. This is not wishful thinking, it is biology. The nervous system is not a static structure that simply wears out over time. It is a living system capable of repair and renewal under the right conditions. Many people who began supplementing with the correct forms of B12 at adequate doses, combined with supporting nutrients and dietary improvements, have reported meaningful reductions in their burning and tingling symptoms over the course of months. Some have regained sensation in areas that had gone numb. Others have found their balance improving and their strength returning. The recovery is rarely overnight and it requires patience and consistency, but it is real and it is possible. The steps forward from here are clear and specific. Start by speaking with your doctor about getting a complete picture of your B12 status, including the methylmalonic acid and homocysteine tests. Bring a list of every medication you are currently taking and ask directly whether any of them are known to affect B12 absorption. If they do, ask what monitoring and supplementation protocols are appropriate for your situation. Then, with your doctor's guidance, begin a supplementation plan using a high quality, bioavailable form of B12 at a dosage appropriate for your needs. Add the supporting nutrients. Improve your dietary intake of B12 rich foods where possible. And then be patient with your body because healing takes time. You have spent too many nights wide awake with burning feet and too many days managing a discomfort that has been dismissed as inevitable. It is not inevitable. It has a cause. That cause is identifiable and it can be addressed. The path forward begins with asking the right questions, getting the right tests, and refusing to accept that feeling this way is simply what getting older means. Your nerves kept you going for 60, 70, 80 years or more. With the right support, they still have the capacity to serve you well. Do not give up on them. And do not let anyone tell you that what you are feeling is something you simply have to live with.